Manipur ki rural area da All India Institute of Medical Sciences AIIMS ki Thakta Leiba Hospital ama Lingkhatpagi Tangai Phadaba Leire HAINA RAJYA SABHA ki member NINGTHOU SANAJAOBA LEISHEMBA House ki PUKNING CHINGSHINKHRE ngasi pham ki ba parliament mifam da wafam asi special mention oina pukhaladuna MP NINGTHOU SANAJAOBA LEISHEMBA hai leiba ga sigi tongan tongan ba mafam da AIIMS Hospital kunmanga haukiba chahi khara sida lingkhatpang ngamkiba simag Prime Minister Narendra Modi na luchingba NDA lengak asigi singthaningai oiba mai pakpa amani leiba ga sigi mioi crore chamaga nifurom leiriba sigi healthcare gi mathau taba sing phanghanabagi pandamda AIIMS ki Thakta Leiba Hospital sing India gi kachin koya sinba thungna hangdoktuna manung hanjinba amade khungangda leiriba miyamgi ana layengda kudong chaba pinabagi damak honaba mathau tai Thaurang asi khungangi leita laira miyamda afaba makhalgi ana layangi khudong chaba phanghanba ngamgani Manipur gi oina leiriba mishinga changdamnabada hauzik leiriba medical gi infrastructure asida awatpa kaya leiri afaba ana layeng sangseng masing watpana maram oiraga mioi kaya ana layangi dama atopa stat singda chatpada seltum gi khudong chadaba kaya mayok nei maram aduna stat asigi leita laira ba mioi kaya gi ana layengda khudong chaba phanghanaba AIIMS ki Thakta Leiba Hospital ama lingkhatpa mathau tai Asigumba Institute ama thamlabadi cancer yauna atai aruba laina kaya layengbada hena khudong chabu oigani maram aduna AIIMS Hospital ama Manipur gi rural area da linkhanaba thorang tawbiu haina MP NINGTHOU SANAJAOBA LEISHEMBA union government ki pukning makatana chingsinki
Sir, within a short span of time, there are around 25 AIIMS hospitals established at different regions of the country. This is a remarkable achievement for the NDA government led by the Honorable Prime Minister Sri Narendra Modi ji to meet the healthcare requirements of 140 crore Indians. We need establishment of medical institutes like AIIMS in all corners of the country to extend inclusive health care facilities to remote and rural areas of the country. This will enable the rural poor people to access affordable and quality medical care. The present medical infrastructure in Manipur is also inadequate in comparison with population. Besides this, due to lack of expertise, hundreds of patients are going outside the state for medical treatment, facing economic hardship. By establishing an AIIMS hospital in Manipur, quality and affordable health care facilities could be provided to the needy and poor rural people of the state. The institute can be a referral hospital for the entire region, and specific diseases on cancer, which is very rampant in the state, and also complex diseases could be treated. So I urge upon the union government to establish a full-fledged AIIMS hospital in rural areas of Manipur to address the health care of the poor rural people of Manipur. Thank you, sir.